Let's go ahead and establish a quorum. Call the members, please.
Hernandez?
Here.
Hernandez here. Nguyen? Here. Nguyen here. Hall? Mitchell? Monning?
Here.
Monning here. Nielsen? Pan?
Here.
Pan here. Roth? Wolk?
Here.
Wolk here.
Quorum has been established. A couple items of business. File item number 10, SB 1308, Nguyen will not be heard today. We have item number 3, SB 1067, Huff, Food Facilities. File item number 8, SB 1258, Huff, Pupil Health Food Allergies. Local Emergency Educational Agency Policy are in a consent item. And with that, looks like we have Senator Bell, who will be up first. Item number 9, SB 1291, Medi-Cal Specialty Mental Health, Children and Youth. Good afternoon and welcome.
Mr. Chairman, members, good afternoon. Before I begin, I'd like to make sure everybody on the committee, they're handing out copies of our amendments to issues raised in the committee analysis. Now, these amendments were drafted in coordination with our committee staff and will be formally adopted when this bill goes to the Human Services Committee on April 12th, assuming that we get formal approval today. Last year, the California Senate successfully led efforts to pass legislation to stop the overprescription of psychotropic drugs to control foster youth with behavioral problems. This was myself and Senator Monning, of course, and Senator Mitchell. However, there were lingering questions about the responsiveness and efficiency of the delivery of mental health services. To get answers and increase accountability, this bill, SB 1291, proposes to consolidate data from existing sources into a single plan, the county mental health plan, under the oversight of the appropriate regulatory agency, the Department of Health Care Services. Now, specifically, SB 1291 requires the county mental health plans to stratify data elements for foster youth and create annual foster care mental health plan detailing service array from prevention to crisis services available to these children in a standardized format, clarifies the state role and oversight of the foster care mental health plans, and authorizes the Department of Health Care Services to review plans for deficiencies, communicate with counties to improve plans, and to make public the finalized plans. Now, this bill authorizes the Department of Health Care Services to take corrective action and increases transparency, requiring data to be posted on the web. And then we have witnesses. I'll turn my time over to witnesses, Mr. Chairman. Shaniqua Arlington is here to testify, as well as Anna Johnson. So I'll turn it over to witnesses, Mr. Chairman.
Good afternoon. My name is Shaniqua Arrington, and I was in foster care for 14 years, and during that time I took many medications. Often the harmful side effects of medication are worse than the potential effects that it could have. They cause a lot of damage, both physically and emotionally. Emotionally, I was absent within my body. I wasn't there in mind. And physically, my asthma, it flared up, and I gained a lot of weight. My group home staff, they had little to no understanding of what the medications were or what they were for. I was given medication when I did anything wrong or I made a mistake. My group home staff would suggest higher dosages or more medication. My experience is not unique. It happens a lot. Many times group home staff prefer children who are medicated and to help them keep them compliant, because people just don't want to deal with the behaviors. rather than suggesting other solutions such as talk therapy or activities to help work on the issue at hand. And labeling kids with mental illness has a financial incentive for group homes and foster parents who receive additional funds for caring for children who are diagnosed and receive mental treatment for mental illnesses. As a result, I believe that medication should not be the first resort. There are other means, rope courses, animal therapy, even sports that are effective without having negative side effects. Yeah. I first started taking medication when I was 7. I was placed in 3 group homes where I saw abuse and was abused. I was vulnerable and I was scared and I rebelled. As a result, I was put on medication to calm me down, but all I really needed was someone to talk to me and to listen. My caseworkers and the people around me, they didn't believe me about the abuse, so I didn't get the help that I truly needed. Instead, I was put on multiple medications to silence me and to make me compliant. It wasn't until I was older that I got the help that I needed. There are always ways to help a child without always resorting to medication first. For me, I just needed talk therapy and something to keep me active. I went to a behavioral treatment facility where for the first time I received talk therapy that around my life circumstances rather than about taking the medication and what they were for. It was here that I took a ropes course and I began to learn to conquer my fears. For the first time in a long time, I had something to do. I had something to help me channel the anger that I had bottled up inside of me. Most kids just want someone to pay attention, to show them that they are loved and cared for. They deserve someone who is there to protect them and not to harm them. When kids are removed from homes or going through trauma, medication should not be the first means of help. Getting over that trauma should be the main focus. Drugging them up is a short-term, short-sighted solution because it may hold the trauma at bay, but eventually the trauma comes back. Most importantly, no one ever asks kids what they need or what they want. Adults assume that kids don't know what they want or what's right for them. I don't know how many times I've heard staff at my group home say that they know best, and doing so, they erase me and discounted my lived experiences and my understanding of my own body. As a result, a majority of the time, the decisions that were made were based on what was convenient for them and not what was best for me. Foster youth don't have anyone to speak for them. Only you can. Please approve SB 1291 and improve the chances that vulnerable children get the services that they need. Thank you.
Thank you. Anyone else like to speak in support?
Yes.
Any opposition to the measure? Questions, comments?
Yeah, I'd like to speak. My name is Anna Johnson. Thank you, Chairman Hernandez and members of the committee. I'm from the National Center for Youth Law, and we're the sponsors of this bill. I'm here today to again urge your support of SB 1291 and to emphasize that more has to be done to provide appropriate trauma, mental, and behavioral health care to our children in foster care. These services are legal entitlements, but they have been long denied to this population. Our state has failed to provide the appropriate care and services to children who have survived physical, emotional, sexual abuse, neglect, and children who have suffered the hardships of growing up in a system instead of a community. We know that their physical and mental health needs have gone unmet and that foster children are at increased risk for homelessness, incarceration, poor health, and lower educational outcomes compared with their peers. In removing children from their homes, the state has asserted their position as the parent. In doing so, we have a unique obligation to foster children and foster youth. Right now, we have special terms and conditions from the federal government, the Centers for Medicaid and Medicare Services, saying that California must provide more to oversee and monitor mental health services at delivery for foster children and youth. This delivery and oversight is split between 2 state departments here in California, Department of Social Services and Department of Healthcare Services. To eliminate that gap in coordination of services, SB 1291 calls for consolidating data, as Senator Bell mentioned, under one plan. And we're asking the state really to support children in recovery, healing, coping with trauma, healthy development, and a range of services covering everything from prevention to crisis. Most of our children enter mental health through a crisis situation after their needs have been ignored. After they're done with crisis services, follow-up care is not guaranteed. SB 1291 asks, are services timely, or did they have to wait months for someone to see them? Are the services appropriate to the child's age and culture, sexual orientation, and linguistic needs? We know that 72% of children in child welfare are children of color, 50% are Latino. There's disproportionate rates of African American and Native American youth in our system. Does our mental health service delivery provide for their cultural needs and linguistic needs? Right now, all of our reports are saying, no, we're failing those kids, and we need to have a plan that addresses all of those needs, that addresses our children, our state's children, and support them. I'll just wrap up by saying we know that foster youth have significant needs for quality mental health services. Our diverse counties need plans that consider this special population with realistic approaches to overcoming local barriers to care that are unique to foster children and what they experience as a barrier. SB 1291 is necessary because without it, California does not have a comprehensive approach to oversight and monitoring of the mental health services available to foster and probation children and youth. Thank you.
Thank you. Senator Pan, you had a question?
Thank you, Senator Hernandez. First of all, I want to thank you, Senator Bell, for introducing this legislation. My question is not so much with the purpose of the legislation, but a concern I have on some of the amendments. Certainly, we want to refer to the mental health plans to provide the HEDIS data. I'm just concerned at the level of detail we're actually embedding in code, because in case there are modifications to the HEDIS data going forward based on new research or new information that I think it makes sense to refer to HEDIS because that's what the health plan should be reporting on, and to refer to which particular measures. But I would be just a little concerned if we overspecify what that measure is in code, especially if there's a modification to that measure because of new research or new information, new consensus. Then we may be in a situation where a health plan is reporting one quality measure to the public because that's what the new HEDIS measure is, and yet we're also requiring the report and on an old measure that until we can actually get new legislation to fix it, gets us in it. So I support the bill. I just hope that we can clean that up a little bit. It's fine, I think, refer to ADHD guideline, but not get into what the actual measure is, just so that you have some flexibility there to accommodate potential modifications in the future to the HEDIS measure.
Yes, we can work on that. That's common sense.
Okay, is there any other questions, comments from any of the members? Any opposition? Didn't see any opposition. I'm assuming, Senator Bell, you work with Senator Pan. No need to bring it back to the committee, but I'm assuming
we'll work with Senator.
Address some of the concerns you have. Absolutely. We're still early in the process. We have a motion by Senator Nguyen. Would you like to close?
Just that this bill's on the protections we did last year, and hopefully a few other bills this year. And develops a comprehensive approach to effectively monitor and oversee our mental health services available for foster youth. I urge and I vote on this. Thank you.
Thank you. Chair's recommending aye. Item number 9, SB 1291, due pass to rules. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Aye. Nguyen, aye. Hall. Mitchell. Monning. Aye. Monning, aye. Nielsen. Pan. Aye. Pan, aye. Roth. Wolk. Aye. Wolk, aye.
That has 5. Enough. We're going to go ahead and put that bill on call. Why don't we go ahead and move the consent calendar? Item number 3, SB 1067. Item number 8, SB 1258, moved by Senator Wolk. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Monning. Monning, aye. Nielsen. Pan. Pan, aye. Roth. Wolk. Wolk, aye.
Okay, seeing no members, looks like Leno and Galgiani are the only ones that aren't on the committee. The consent calendar, real quick, 5-0, we're going to put that bill on call. Okay. So what we can do, if you like, why don't we move to Senator Nguyen, if you're available?
Mr. Chairman, I'm still waiting for a few more witnesses. Can you give us a few minutes?
Then we will move to Senator Monning. Would you like to present? Item number 5, SB 1135.
Good afternoon, Mr. Chair, members. Senate Bill 1135 requires health plans and insurers to notify consumers and healthcare providers about patients' rights to timely access of care and language assistance. The bill also requires insurers to include the toll-free consumer call center number of the appropriate state regulator on the consumer's insurance cards. Very few consumers know that they're entitled to timely access to care and where to file a complaint with state regulators. A recent survey found that 85% of California consumers do not know which state agency is tasked with handling complaints about health plans and insurers. The primary goal of this legislation is to help inform consumers about their rights when dealing with health care issues and about who to call when they're having problems. This will also lead to more accurate complaint data for policymakers and regulators to take appropriate actions. For example, consumer complaints are one of the strongest indicators that state agencies have in monitoring network adequacy issues. Senate Bill 1135 requires that the timely access timeframes be included in existing documents and communications that plans provide, and I'm willing to work with the plans on how to appropriately place the toll-free number on the consumer's insurance card. In sum, it is important for consumers to know their rights and where to go for assistance. Mr. Chair, with your permission, I'd like to present witnesses in support.
Good afternoon, Mr. Chair and members. My name is Tam Ma, and I'm with Health Access California, the state healthcare consumer advocacy coalition, working for quality and affordable health care for all Californians. We're proud sponsors of SB 1135, and thank Mr. Monning for authoring this important bill. California law requires health plans to have adequate networks and to provide timely access to care. This means that there are time limits on how long you have to wait to get health care appointments. For example, most consumers don't know that they are entitled to get an appointment with a primary care provider within 10 business days or a specialist within 15 days. Consumers also have a right to language assistance, including interpreter services, at the time of the appointment, and the appointment should not be delayed because interpreter services are not available. They should be provided at the same time. The purpose of the timely access law is to make sure that patients get the care they need when they need it. Unfortunately, most consumers don't know about these rights, and they end up waiting, oftentimes end up waiting for weeks, if not months on end for an appointment. These timely access requirements are a fundamental part of our network adequacy laws, which require health plans to have enough providers in their networks so consumers can get the care they need when they need it. These rules apply to both commercial and Medi-Cal managed care plans. If consumers are not able to get timely appointments, then it means there may be problems with health plans' networks. Consumer awareness, coupled with regulatory oversight, will help consumers get the care that they need. SB 1135 gives consumers information about their existing rights to timely access to care by requiring plans to provide this information through existing communication channels. The bill also requires a toll-free phone number for the regulators' help centers to be on the insurance cards so consumers know where to turn if they're having problems with their health plan. It's important for consumers to be informed of their existing rights and get the care they need when they need it. Therefore, we respectfully request your aye vote on this bill.
Good afternoon. Betsy Imhold, Special Projects Director for Consumers Union, which is the policy and advocacy arm of Consumer Reports. California stands out amongst the states for its strong quantified standards of how quickly health plan enrollees are entitled to get appointments for health care. Yet consumers, many of them and most, do not realize they have these important rights to prompt care as well as to interpretation services. In addition, both the Department of Managed Healthcare and the Department of Insurance have complaint hotlines to help consumers who've been unable to get timely care, as well as on the range of other problems that may arise with their health carrier. Senator Monning referred to a survey, that was Consumer Report survey last year of Californians, that found that 85% of them didn't know which state agencies charged with handling their health plan or insurer complaints. And this confusion, of course, is complicated by the fact that we have two health regulatory agencies in California. Moreover, the survey found that 71% of Californians were unsure of whether they had a right to independent medical review if their plan refuses coverage altogether, despite the fact that independent medical review has been the law in California for several years. A recent report that we did about consumer complaints and the importance of them, called Canary in the Coal Mine, stated the results for consumers pursuing a complaint with our regulatory agencies are quite good, quite favorable, and about 50% of the cases, the plan's initial decision is reversed in favor of the consumer. So by requiring this contract information, which the bill does require, on the card, rather, the information about the hotline number, it will ensure that consumers are better informed about their rights and how to get the value from their health plan. Thank you.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty. We're here in strong support for the reasons stated, and we would just like to thank the sponsor and the author for making sure that all Medi-Cal members know where they can call. As you know, Medi-Cal managed care plans are not all created equal. The county organized health systems are not currently licensed by the Department of Managed Health Care. Those consumers can't get help from the Department of Managed Health Care, but they can get help from the Managed Care Ombudsman. So we appreciate the addition of that and hope we can get to a point of also advising those consumers about the timely access standards. Thank you.
Thank you.
Kimberly Chen on behalf of the California Pan-Ethnic Health Network, CPEN, and our colleagues here worked on the initial legislation that ensured that consumers had access to interpreter services, and that should not be mutually exclusive to timely access, and for that we strongly support this measure and urge a aye vote.
Thank you. Anyone else in support? Name and position.
Yes, Melissa Cortez Roth of Governmental Advocates on behalf of Autism Speaks and the Center for Autism and Related Disorders in support.
Thank you.
Les Shepard, representing the ALS Association Golden West Chapter, in support.
Kieran Savage on behalf of the National Alliance on Mental Illness of California, in support.
Emily Resch with the California Public Interest Research Group, in support.
Thank you.
Michael Young, California Labor Federation, here in support.
Tiffany White, SEIU California, in support.
Mike Montgomery, Congress of California Seniors, support.
Mari Erlandson with the National Association of Social Workers of California. We support this bill.
Thank you.
Lynn Jung with the Southeast Asia Resource Action Center, in support.
We have another support there.
John Joseph, AARP California, on behalf of 3.1 million members in the state, in full support.
Thank you. Opposition.
In the tweener category today, good afternoon. Christy Weiss on behalf of the California Association of Dental Plans. We don't have a position on the bill yet. We've had good conversations with the sponsor and with the author staff. The challenge for the dental plans is with the ID card provision. Many of the dental plans don't provide consumers with ID cards. Dentists don't ask for them. The dental plans have just moved away from that practice. So they are struggling with the interpretation of the bill that they would have to now change their practices, provide ID cards, and include this additional information on them. So again, we're having good conversations with the author and the sponsor, and we are cautiously optimistic that we can reach a resolution. Thank you.
Thank you.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. We too met with the author and sponsor earlier this year and had a productive conversation. Unfortunately, today we are in opposition to the bill. We feel Right now, we currently do provide this information on an annual basis as a part of a newsletter or other documentations that are provided to the insured. I think our concern is as we continue to sort of add to the evidence of coverage or other documents, do you make those documents so unwieldy that you actually discourage people from reading them because they feel so overwhelmed by the amount of paperwork and stuff that they get? So we want to make sure that when we are corresponding with our insureds or enrollees, it's a meaningful correspondence, that we encourage them to understand their rights. We also do have some concerns about adding additional information to the ID card. Again, it's a small card. I think some of us even have 2 pages now as a part of our card. It just becomes less and less meaningful as we continue to add things on. People stop seeing what the important information is and sort of lose track of how to actually correspond with their insurer and get the information that we think is really important. So, I mean, we do look forward to continuing to have conversations with the author and sponsor if the bill moves forward today, but unfortunately we are in opposition.
Thank you.
Thank you, Mr. Chair and members. Nick Luizos on behalf of the California Association of Health Plans. I don't have much more to add to Stephanie's testimony, but at the risk of exposing myself to a HIPAA violation here, I am looking at my own health plan ID card, which already has 4 800 numbers listed on it. In talking to a colleague in the back of the room, his medical ID card had 800 numbers on it. And so, you know, at some point you kind of wonder, as my colleague from ACLIC testified, whether the information continues to be meaningful if we keep loading it up with additional information. I will say that one of the more philosophical concerns we have here, we have set up a grievance system in the state of California that really is premised on the consumer resolving their grievances with the health plans first before moving on to the regulatory component of the process. We have seen in the IMR process, there's documented evidence that suggests that about 25% or a quarter of cases are resolved favorably before they move on to the IMR process. And so we'd like to keep that structure in place. It keeps complaints that could have been resolved beforehand out of the regulatory sphere, and that reduces costs. We have heard testimony recently that some of the government or regulatory 800 number lines have been impacted. So you know, we want to try to help that situation as much as possible. So we do appreciate there was one good amendment that went into the bill recently, but we still continue to have concerns based on administrative costs to the health plan. So we're in opposition. Thank you.
Thank you. Anyone else in opposition? Any questions from any of the members? Yes, opposition? Yes.
John Winger on behalf of America's Health Insurance Plans, also opposed.
Thank you. Questions, comments from any of the members? Seeing no questions or comments, is there a motion? It's moved by Senator Pan. Would you like to close?
Very briefly, thank you, Mr. Chair and members. Just wanted to touch on a couple of things. The bill does not create any new rights or obligations. What we're doing is taking the existing timely access law, making sure that consumers are aware of their rights to access based on the type of care they are seeking, primary care, specialty care, emergency care, that they do have by law today a right to timely access. We want to make sure they're aware of that, asking the plans and the insurers to include this information on websites and the materials they send out to consumers annually. They don't have to redo anything. This is prospective. The issue of the phone numbers, those cards bearing numbers of the plans, 800 numbers to the plans, we don't discourage a consumer contacting the coverage plan as a line of first engagement. But they do need to know that they have rights to contact the different regulators, DMHC, Department of Insurance, and how to do that. We also think it will inform the state that is overseeing the plans, the Medi-Cal delivery, our new enforcement and inclusion of competitive plans through the extension of the Affordable Care Act in California. We've created a maze of different types of coverage. We want to make sure consumers know how that can be redressed if there's a problem, and for us as a state to know if one plan, for example, has 80% of the complaints of lack of timely access, that should inform what we do as the state to see if we can smooth that out. So for those reasons, I would respectfully ask and I vote. Thank you.
Thank you. We're at item number 5, SB 1135, due past appropriations. Call the members, please.
Hernandez. Aye. Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Monning. Aye. Monning, aye. Nielsen. No. Nielsen, no. Pan. Aye. Pan, aye. Roth. Wolk. Aye. Wolk, aye.